Mr. Panetta.
Thank you, Mr. Chairman. Thanks to all the witnesses for not only your testimony today, I know you guys probably prepared quite extensively to be here, so I appreciate this opportunity because it really is a chance for us to address an issue that we've been hearing a lot about, and that's the barriers to accessing a commercial insurance plan affordably. It's a good opportunity to discuss the serious, complex challenges facing our health system, but also the potential for bipartisan, common sense, long-term reforms that I believe we should be pursuing when it comes to our health insurance. Now, this is my second hearing this week on health care. And as you've seen, and I think as you understand, it could easily delve into partisanship. And I get it. There were some pretty partisan bills passed into law this year that cut health care and increased prices for health care insurance. But as we've heard, there are chances for bipartisanship that could restore Medicaid, extend the ACA tax credits, along with a long-term compromise of reforms to fight fraud and overhaul insurance policy. And I hope that the current majority chooses to work with us on that type of policy rather than put forward another partisan reconciliation bill, especially when it comes to healthcare fixes that add to our debt and deficit. Now, with that said, I would like to focus on an area where we do have bipartisan cooperation in the insurance space, and it's about addressing ghost networks and Medicare Advantage. Now, I admit that when it comes to healthcare, my top priority in Medicare policy is Medicare policy and working with Dr. Murphy, Greg Murphy, on this committee to find a fix for traditional Medicare payment reform. However, I also want to talk about a piece of legislation that I helped author called the Real Health Providers Act. It's a bipartisan piece of legislation that would address these so-called ghost networks. The bill, all it would do, require Medicare Advantage insurance plans to update their provider directories annually. It would also require those insurance plans to honor the in-network price if they mistakenly list a provider that they no longer accept. The bill, if signed into law, would mean that patients on Medicare Advantage plans would erase ghost networks and build a reliable health system for our patients and our constituents. First, Mr. Chairman, I ask unanimous consent to submit for the record this letter from Mental Health America regarding the Real Health Providers Act and other issues before this committee.
Without objection.
Thank you. And my question to our panelists and I'm going to just go down the line, starting with Mr. Helmsley. Would you support this type of legislation and other efforts to regulate and rein in ghost networks?
Congressman, thank you for the question. I'm not familiar with the legislation, but we would definitely be aligned with making sure there's integrity in the networks, that they are maintained, that if there are errors in them, that we are responsible for them. Along those lines, yes.
Thank you. Mr. Joyner.
Yeah, Congressman, I'm not familiar with the legislation, but certainly would support. I think this is a big challenge for the industry, and I would also make sure the providers are held accountable for updating their information as well. To have a broader national provider directory that's centralized and potentially run by CMS.
Understood. Thank you. Ms. Boudreau.
Congressman, we work very hard to ensure that our networks are adequate. We support working with care providers. We ask them every 90 days to update that and would support the opportunity to share data more regularly so we're both accountable to making sure not only that there's access, but it's correct. We recently added 50,000 behavioral health because we know that this is a real challenge with the amount of demand that there is, so it's also about having access to those providers. So we support opportunities to work on that.
Thank you. Mr. Cordani.
Congressman, we are not in the Medicare Advantage marketplace, but we support the tenants in our commercial marketplace for transparency and accuracy.
Great. And Mr. Markovich?
Yes, I support everything you described. Thank you.
Great. Thank you. Ms. Young, I'm not going to make you answer this unless you want to. Fair enough. With that, I yield back. Thanks again to all the witnesses, and thank you, Chairman, for this hearing.
Thank you, Mr. Feenstra.
Thank you.